This way.
I think TikTok way.
Okay.
Or no, maybe YouTube way.
Yeah, I think
then it
YouTube
can have
way.
different angles.
There's a YouTube way and a TikTok way?
Yeah, so this one's a YouTube way, which is better quality and longer.
More landscape.
Yeah,
And TikTok is
16 by 9.
Yeah, it's like a
portrait versus, what's the other thing
Landscape.
called? Landscape.
ish, yeah.
Okay.
Cool.
Good.
Yay. How do we start?
So you filming?
Yeah.
Okay. So my name is David Bell. I'm an orthognathic surgeon in Orange County, California. And I decided that I want to make a video, an educational video, to allow people to understand that they're part of a community when they're having orthognathic surgery. There's a worldwide phenomenon now that there's any number of support groups, whether it be on Reddit or on Discord or on Facebook, where people exchange ideas, they private message one another, and they share their experience and information to support one another. Orthognathic surgery's got profound benefits for people. I can say that all day long if I want, but I've never had orthognathic surgery. The people that have had orthognathic surgery can speak to it. So I had a very interesting experience during the past 2 weeks. I operated on Ashley 3 weeks ago. She's a redhead, and she does a lot of content on TikTok and YouTube, and documented her entire pre-surgical and post-surgical experience beautifully, and she's quite articulate. Marissa had surgery 6 days ago, and as I understand, Marissa, you've been following Ashley for quite some time, right?
No, because you showed me Reddit, and then someone said, "Oh, that's Ashley," and I was like, "Oh, that's awesome."
And then you started doing it. Okay.
That's
So,
crazy.
yeah. So Marissa had, fair to say, the first 36 hours were kind of tough for you, right?
Yeah.
Yeah. I think the first 36 hours for most people, or 2 days, can be tough for anybody. But traditionally what I've done pre-surgically, especially with women, I try and match them up with another person that's had surgery, usually close to the same age, the same facial phenotype, and is undergoing something similar so they can share their experience. This happened to be a beautiful coincidence that I've got these two beautiful redheaded women, and they were displaced in terms of having the surgery by 2 weeks. So I arranged to have Ashley here one day at a follow-up for Marissa, and they've met 3 times, is that right?
Yeah.
3 times, yeah.
Now.
And so that's the whole setup for this whole thing, and I will turn it over to the recipients of having surgery and turn it to them to explain what their motivation for having surgery was, their journey, and what their recovery has been like. And this is to share with people so that they understand that by creating a community of 2 here, I also do a lot of educational content on Reddit, so that makes me part of a community. And so as we build communities, people can feel more a part of something and have hope. And that's really what I hope to give to people in support. So I'll leave it to both of you to describe your motivations, your journey, your experience.
Do you want me to start?
Yeah.
I am on my 16th month of journey with double jaw surgery. I was just talking to Marissa about how I found Dr. Bell. I went to a couple of other surgeons before I found the one for me. I had one conversation with him, and I just knew that he was going to be extremely personalized, and that was really important to me. I think some of the other surgeons that I had gone to, it was more of a generic experience, and I just really wanted something tailored for me. I live in Northern California, and Dr. Bell is in Southern California, and it has been pretty seamless to be able to travel back and forth. I feel very fortunate that I was able to do that. And I think when we had our first in-person consultation, I felt really confident in the projected plan before we even knew for sure what we were going to do. After surgery, for me, I went to a recovery center for 3 days, and I couldn't recommend that enough. I think that that really made it so much easier for me. I know that you mentioned that you had a rough time, and the first 36 hours or 72 hours were really intense because your swelling is the highest it's going to be throughout the entire experience. But something that I'm really grateful for is the hyperbaric oxygen therapy. I talk about that online a lot. I think that was something that really, really helped. And my motivation for surgery was I initially went in for orthodontic treatment, and I just wanted to see what was possible. I knew that some of my anatomy was a little bit underdeveloped, but I had researched double jaw surgery, but not extremely significantly, and my orthodontist thought that that would be a route to go on, so that's when I kind of started researching and things. And I couldn't be more grateful. I did a sleep study. I found out that I had sleep apnea, I had a narrow airway, and another motivation of mine was to make sure that I was being pretty particular about my aesthetic outcome, because obviously double jaw surgery changes your face, and I wanted someone that was really considerate of my preferences, and you were, and that was a deal breaker for me. So that's pretty much my journey. I'm hopeful that healing is going to continue to be pretty smooth, and I know that I had to mentally, physically prepare for this because it's such an intense thing to do, but I was ready.
I want to ask you some questions.
Okay.
I think I know some of the answers to these anyways. So among your goals are your needs, your long-term needs, you have short-term needs and long-term needs. What were your most important long-term needs?
I think the biggest one for me was my energy level and sleep apnea. My family has a history of sleep apnea and just a very recessed, underdeveloped chin. And that was, I would fall asleep midday. Eric and I would go to the movies, and I would fall asleep during the movie, and I really didn't want that to get any worse over time. And then I would say that my second priority was that the aesthetic outcome would be something that I liked and somebody that I recognized, because I didn't want to be jarred at the person I would become, because this is the person I have to live with for the rest of my life. So I would say lifestyle and health was priority number one, and then aesthetics were number two.
Thank you. And Marissa, you told me that Marissa's a mother of 2 children. She met the love of her life, John, who is here in the background. And it's really important to have, and you two can kind of speak to the absolute critical need to have the support of loved ones throughout this journey, both prior to and after.
Yeah.
You told me that as a mother of 2, after meeting John 4 years ago, one of your major goals was to have another child and to be physically healthy enough to be with an infant.
Yeah.
How old are your kids now?
11 and 16.
11, 16, yeah. So,
Starting over.
over.
Yeah, and it being like 39 and then probably starting at 40, you know, I wanted to be all there. So,
Oh, there, yeah. Can you speak to your aesthetic or functional goals, like how, in terms of importance, how important were those to you?
Yeah, I think they go hand in hand, and that's something I realized as I started getting older and seeing my face change, because like everyone has a bone structure, and then how the soft tissue ages over the face kind of gave me some clues as to maybe something is unhealthy about my face, because I had like this lifelong struggle with energy and just like having aspirations but not being able to achieve them. It's just really frustrating. And then also wanting to be there for my kids more presently and to be able to do more for them. So I would say that the aesthetic thing, it's like a far second, but it is second, because like we live in this world where there are so many people who have unhealthy faces that go and get aesthetic treatments thinking that they're like looking younger or like improving the way that they look when they don't understand that underlying like these imbalances and like harsh aging lines that they see is just that their face is not healthy, like the infrastructure of their face is not healthy, and that they probably have health issues like I did. My sleep study shows that I have upper airway resistance syndrome, and I'm not an overweight person, but I just have a really small airway. So my skull did not grow large enough to accommodate a big, juicy airway. Knowing that it's very possible that this could be getting worse, I just wanted to start pursuing what it could look like to fix it at the root. And I kept seeing doctors that wanted to give me mandibular advancement devices. Another one mentioned a CPAP. Another one mentioned an Aspire. And I'm like, these things don't have a long-term, like, successful outcome. It's just like a Band-Aid. So I had to really wrap my mind around the idea of like getting to the root. I have a great orthodontist, and he was the one who mentioned jaw surgery to me.
That's probably worth mentioning his name.
Dr. Ting, in Rancho Santa Margarita. We're here in Orange County, so he's local. I'm local to Orange County.
Which is unusual. Most people come see me or not.
Yeah.
But he does.
Yeah.
I think you're the first patient that of Dr. Ting's, and since then he's been sending me 3-4 patients like every week already. Yeah,
oh, wow. That's great. Yeah. So, I would be his first.
Your first
one.
patient, yeah.
He's like really excited to see how it's turning out. So, I saw Dr. Ting first because he's an airway orthodontist, and he expanded me with MSE, and I got instant nasal like breathing through that process, but I still had an abnormal sleep test after that, and so it made me nervous. I was like, oh my gosh. So I was like, okay, I really need to search for a jaw surgeon I guess I always go with my intuition, but this time around I went with like a checklist. I kind of went against my intuition, and I kind of thought a little bit differently in my pursuit for a jaw surgery because it's such a serious. There's a lot you hear a lot of bad stories, but I really wanted to find a surgeon who had a lot of good stories, and I think those are harder to find because people are not raving about how amazing their jaw surgeon is. They're just like going with their life. So I was lucky to find about Dr. Bell through the Jaw Hacks community, and then he was interviewed by Ron Eads, like in this process, like that I had been speaking to him, and I think that interview really helped me to understand more of who he was, and like the way that I like to describe Dr. Bell is he's like all things everything. he's like all things compassionate, all things kindness, all things intelligent, all things like moving forward. He's a lot of good. So it was like, is this too good to be true? And so far he delivered on his promise, and I feel like the first few days were very rough, which I have heard, and I was able to I saw Ashley's content, Kareem is someone else that I was able to talk to, and they have all recovered beautifully, so I knew I just had to, bear through it, and I did not recover at the same center that she did. I recovered at the surgical center, which was fine. The nursing was fine, and then my amazing boyfriend took over from there, and now I'm day 6, and talking is really hard, and Dr. Bell's making me do this.
Making you or inviting you?
I said yes, so yeah. So I'm really passionate about this because there's so many people that are like, oh my gosh, why are you doing this terrible thing? I'm like, why is it so terrible when you want to improve your health? You know, people always get scared about the initial process, and they don't understand. I think it's kind of like high risk, high reward. It's not risk necessarily. It is risk in a lot of ways, but like you just have to get through that healing. But also, I wanted to say too, one thing I love about Dr. Bell and his practice is that they have a 360-degree approach to all things patient care, when it comes to finances, pre-op, post-op planning. Like, it's so detail-oriented, and like I said, it seemed too good to be true, but everything really worked out very well in all regards, and I'm lucky to have him be local to me, so that's, I feel like that was the cherry on top, so yeah.
I completely relate to what you're talking about with aesthetics, because I think in the modern era we see so many instant gratification options, and that was something that I even discussed with my orthodontist. I was just like, I want a more prominent side profile. Is that something that we can do with orthodontics? Like, what do you think about a chin implant? And I love her response, because she was like, you don't want to do that. You want to go the like delayed gratification to be worth it. And that was something that was really important to me, is not only the aesthetics, but also the long-term benefits, and to be able to be there and healthy over the long term. So I think that that's something that I talk openly about in person and online.
Yeah, you make a great point, and I just want to follow up on something you said, Marissa, too. You used a couple terms. You said MSc, and can you explain what that is for people?
What did I say?
You said MSc. I had an MSc.
Oh, MSc. It's a maxillary. What's the S stand for?
It's a distraction procedure for expanding the width of the upper jaw. So on a technical point, there's two main areas for airway obstruction, up here and down here. Up here we call it upper airway resistance syndrome. You had upper airway resistance syndrome, which was largely fixed by the MSc. And then the other area is obstructive sleep apnea, where the area of obstruction is down here. So as it turns out, you had a expansion from Dr. Ting of the magnitude of about 5 to 6 millimeters.
Mm-hmm.
And I did do a segmental maxillary osteotomy on you, not to widen the upper jaw, but just to optimize the fit. And I brought your jaw forward 6 millimeters and 16, right?
Mm-hmm.
Ashley, on the other hand, had an expansion as a child, and she was adequate width already. So I did not segment her maxilla. Her upper jaw was in one piece. And I brought her upper jaw forward 8 millimeters and her lower jaw forward 18 millimeters. One thing that I see a lot and is important for people to understand is that obstructive sleep apnea is a progressive disorder. All disease processes are like that, and they're progressive because of the consequence of aging, with less elastin and less collagen in tissues. So as people get older, the airway collapses when they're lying down. So it's really important to plan for long-term results and also protect the airway long-term. And there was something you mentioned I just want to follow up on, is you talked about various ways of camouflaging things with a chin implant. Mm-hmm. And so I always invite people, when they're approaching me for help, to think about their long-term needs and their short-term needs. And when people are young teenagers, they're short-sighted, but they rarely think about their long-term needs. I always encourage people that if there's a mismatch between their present resources, so we all have needs and we all have resources. Resources could be financial resources, the support of loved ones, and we should pay homage because we've got two people in the background here. John, who has supported Marissa throughout this process, and Ashley's brother, who is currently the videography on here, Eric. If there's a mismatch between long-term needs and short-term resources, it's far better to wait and until the resources are there. As hard as that is, I would say, because I have so many people that come to me for revision surgery, this is probably one of the most important decisions of your life. And so much can go wrong. It's really important to have outstanding orthodontic care and a very cohesive care team. The primary people involved are the surgeon, the patient, and the orthodontist, and everyone has to be on the same page in terms of what their goals are, what the plan is, who, what, where, when, and why, how much it's going to cost, how long it's going to take, and with that plan, when with good practitioners, good doctors, the chances for success are really, really high. Without that, the chance for failure is staggering, and I see that a lot, unfortunately. How did you find your orthodontist is Dr. Cook, right?
Yeah. Dr. Cook is a really prominent orthodontist in my local area.
Which is?
Napa. And I didn't go to her as a teenager, and I really wish I had gone to her as a teenager because I think that maybe we could have avoided and she could have been able to expand some of my bone structure when it was still developing as a teenager. But I trust her completely, and she was
not
the
18
one.
millimeters. Though.
Not 18 millimeters, of course not. But I think she could have maybe done something with the upper jaw when I was a teenager. But she recommended that I pursue researching double jaw surgery. And so I really, really trusted her expertise opinion, and it really paid off because it led me to you. And she trusted you, and I think that that really significantly helped. And something that you mentioned in the beginning is the community of people. I think that I researched extensively about post-operative care. I got all of the supplies, I was watching all of the videos, I was reading things on TikTok, and you can still be confident in that, but I remember I saw one of Dr. Bell's patients after 8 weeks post-op, and it relieved so much anxiety for me. I was able to actually speak to somebody in person who was going through it, and then even meeting you, I think that it relaxes the nervous system so much to know that you're not alone, and I think that that is invaluable to me.
Yeah, you mentioned something really interesting. Well, you mentioned the name Kareem. Kareem is a patient of mine. They're supposed to be initially as a patient. He's also a friend of mine, and he runs my practice. Right, he's my practice manager. So you were referencing his recovery at 2 months. Yeah. What I want to say is that Kareem is many things that are fantastic, but one thing that he is he's an expert in business and also finance. And at one point we were looking at what is the most important, what is the highest area of interest with orthognathic surgery, and so we looked it up, researched it multiple ways, it's post-operative recovery. That is more so than finances, more so than risks. That is the thing that people are truly interested in. My post-operative instructions are how long? 18 pages?
Yeah, 18 pages, and you read them 118 times.
And people say that I'm turning into a different person after surgery. I'm very strict, and I am. But what I found is with people follow those instructions to the T, they do quite well. And risk has been mentioned. You mentioned another term, hyperbaricosity. Do you want to speak to that, or do you want to speak to that?
I can speak to it. I really hadn't ever heard of it. I had briefly heard about it, but I did 10 sessions of hyperbaric oxygen therapy.
Oh, what is it?
It's you go into a chamber and it creates pressure, so it allows the body to absorb oxygen more thoroughly, if I'm understanding correctly. And right after surgery, I think I started 3 days post-op, and it was really difficult at first just because you're so swollen and your ears are having a lot of pressure, and you have to clear your ears in the same way that you would go scuba diving. But the people that we worked with were so accommodating. They were so gentle. They allowed me to communicate my needs because obviously you're really figuring your body out again post-op. But after 5 sessions, I noticed a complete difference. And then once I got to 10 sessions, I looked back and I was like, wow, I don't think that I would have had my swelling go down as much as I did during hyperbaric.
Yeah, we were very fortunate to find a service that comes out to people's homes. So they have a van and they have a hyperbaric machine.
And they
And
came
they
every
came
day,
every day.
straight to the driveway. It was so nice. You didn't even have to really do anything.
And Marissa, you're on day 5?
Yeah, just finished day 5.
Yeah, so normally people have 10 sessions, or they call 10 dives, because you're in a high pressure, up to 2 atmospheres, or 97% oxygen. And so what, I'm curious, like you're 3 weeks out now, you're 6 days out. What do you think has been the most helpful in terms of physical interventions, human interventions, mental interventions that has contributed to your recovery?
I think number one is like having open communication with you and seeing you every day. I wasn't expecting that. I didn't know.
Say it again.
Seeing you every day. I didn't know until I watched her TikToks. I was like, oh, this is awesome. And then that's probably number one. Your instructions are very detailed, and I think that's important too. And then having a person that I think someone that like really gets you and can help you. Like my boyfriend was just like getting me medicine on time, food, making me comfortable. So yeah, that's very important.
My number one is the same. I think having pretty much daily access to you post-op. Dr. Bell came to my bedside less than 24 hours after my surgery, and I remember asking the nurses, like, is he coming? Is he coming? And immediately when I saw him, it relieved so much anxiety because you're so swollen, you don't know what's happening, you're barely getting your medication down, you're barely eating. So to just see the person who knows exactly what happened during surgery, knows the plan thoroughly, was really, really reassuring. And I think I rave about hyperbaric. I think that also contributed significantly. And your post-op instructions about getting up and walking and taking naps and all of that sort of thing creates a sense of routine, which I think you need when you're post-op.
Yeah, the features that I think that Reed took, in my view, from been doing this for quite a long time, is having the support, the emotional support of loved ones, the emotional support and trust in the surgeon who is watching you like a hawk, that can provide reassurance, psychological support, answer questions, because we have a cognitive part and an emotional part that needs information. Those things are extremely important. The other things, in my view, are weighing daily, having adequate fluid, monitoring protein and fluid intake and nutrition, oral care, cleanliness, maintenance of nasal airflow. All these things are extremely important. And what I've noticed is like every little milestone that a person reaches is significant. Like taking out the sutures. Marissa's still got her sutures on the side of her face. There's 2 tiny little incisions here. Those are going to come out tomorrow, the next date. But I took the tape off yesterday, right? So,
It's
the little things, the lip care, not having crust in your mouth. These are, every little thing is important, I would say. Would you agree with that?
Yeah, I would agree. I think something too that it made me think of is I'm someone who likes to know how things work in order to feel comfortable with what's going on. And you are so great about answering questions and helping me actually deeply understand what's going on with my body. I have found with a lot of medical practitioners, they don't really explain what's going on because they're the expert and you kind of just are supposed to trust. But I have trust and also the education and understanding of what my case is, not what just jaw surgery is in general, which is really, really nice.
Yeah.
Yeah, I think, what I hear you saying is, we all have a cognitive part, our frontal cortex, but when we're in a state of fear, our limbic system, which is our emotional part, the two aren't communicating. And when we have questions, when we have ambiguity, our fears come up. Our fears is actually what has allowed us to survive as a species. But when we have fears and we have lack of information, we tend to, with questions and lack of information, which is the cognitive part of the brain, it triggers a fear response. And so to have concrete answers is extremely important. And not only having the answers, but the consistency. If I give one answer one day and a different answer another day, or I'm a different person one day, a different person, you're going, who is this guy? And what if things don't turn out right? What's going to happen then? And so those are the things that I'm always mindful of, because I'm a patient too. I have medical needs and I go to doctors. We all are healthcare consumers, and we all need people that truly care and are invested in our health. So those are some of my thoughts. That's my doctor speak talking, but also David speaking as a human being.
It's true, because the first day I saw him, I had like a meltdown. So he helped me to get situated, and he gave me a weighted blanket and put me in this chair, and gave me time, and he was patient with me, and yeah, I got through it.
Yeah, I mean, you bring up a good point, because I do understand how the nervous system works, and I know you got completely overwhelmed.
Yeah.
And I also know the effect of a weighted blanket. I mean, it's on babies, so it has a profound effect on the nervous system.
Yeah.
You told me you had a minor meltdown one day too, right?
I had it, yeah. I
Or
think
mini
you,
meltdown.
I think you kind of go through mini meltdowns throughout the journey, because again, as much as you research, you really don't know until you're going through it. And I think that as much as you can cognitively tell yourself this is going to be a really intense experience, you're going to be on a liquid diet, you might be constipated, you might be on your period, you might get black tongue, like there's so many things. And so every single day you're taking it day by day, but like you said, with the little wins, it kind of can soften the anxiety a little bit, because I think it's totally normal for anxiety to come up. Eric and I were just talking about this, that I was kind of shaking when I was coming out of anesthesia, and it's like you're in a new environment, you have a new face, you're doing all these new things, so it's totally normal to be anxious. I think it's how you deal with the anxiety and also look at the positive, because for me, I'm like, I don't want to dwell on all of the harder things. I want to think, oh my gosh, my bands are changing, oh my gosh, I'm going to my orthodontist soon. Every tiny step gets you closer to that original intention, which is long-term health benefits and aesthetics for me.
Yeah, something that you mentioned, you kind of glazed over it. So aside from having two women in close proximity to what happen to be redheads, there are some unique things about women and the female population of this planet, which is underrepresented in many, many ways and underserved in healthcare. And I believe it's very important for physicians to really understand that there are unique challenges that women have that men do not have, and be respectful and make appropriate accommodations for those things. And so when I'm trying to pair up patients preoperatively, I always am very mindful of that. It would be very unusual for me to have a woman speak to a man because they're wired differently, right? So I have found that to be helpful for my patients, and I know you two had some similar experiences. So if you want to share them, that's fine. If that is important to state as a reality, and to pretend it's anything different from that is a disservice to all people, not only half the population, but the men in their life that are affected by them and affect them both ways.
For me personally, I started my period like 5 days post-op, and if you're a woman, you know how horrible your pain tolerance can be when you're going through that. And something for me, like an Epsom salt magnesium bath, is like totally a cure for me. And so I remember asking, is it okay if I take a bath? It's all of those little remedies along the way that it's like, of course you can take a bath post-op, because you don't really know, is that gonna heighten my blood pressure or standing up, or is that gonna change things? But being really open and honest about where I was at physically was really helpful for me, because then Dr. Bell could give me recommendations or approvals on some of the things that I could do, because I was more uncomfortable because I was on my period than I would have been if I wasn't during that phase of my cycle. So I felt comfortable enough to share that so that I could get the appropriate care and attention that my body needed in that moment. And it helped, because I took a magnesium bath every single day after I asked you.
Things like the phase of the menstrual cycle, or whether a woman's on her period, constipation, these little things that people may not have a great deal of comfort or degree of comfort, emotional comfort talking about, are extremely important to talk about, because they're part of the human experience. They're part of the post-operative experience. They're part of what it is to be a human being. And so to pretend that they don't exist is really not good on many levels. And I think it's important to honor and respect these things, and to behave in such a way that those things are taken care of, and things are optimized. Part of my goal for every person that I treat is to optimize the entire journey. It's not just, I did your surgery, I took your money, adios, have a good life. It's like, I followed people for a couple of years after surgery, and I think I told Marissa, I texted you one day, I said, I'm looking forward to you sending me pictures when you become a new mother. And these things are really important to me personally, to see people's lives evolve and change, and for everybody to achieve their hopes and dreams. We all have hopes and dreams, and it's extremely important that we have loved ones in our life, or surgeons or other doctors, to be able to help us on our journey towards emotional healing, to self-actualization, to achieve our hopes and dreams. And this is something that's extremely important to me personally. I want everyone to be happy, healthy, peaceful, and free. Right? Do you have any?
I was going to say, I think that created such an unmatched quality of care for me, and paying out of pocket and knowing that your team also was going to help with the insurance, the experience with you has been invaluable. And I think that you don't get that kind of experience in different regards. So you got a favorable things financially? I mean, things that turned out well for you? Yeah, things turned out really well for me. So I paid out of pocket, and then Dr. Bell's team advocated and submitted all of the paperwork on my behalf, and my insurance company pre-authorized that they would consider Dr. Bell as in-network for my insurance. And like I said, I don't live locally, so that is a huge win. And so as much as I was very prepared to pay out of pocket, it was amazing to know that that was also something that could have been the icing on the cake for me. So not only did I get unmatched care, but I also was able to have it pay off in the end because of the resources that Dr. Bell's office and practice offers, which is incredible.
And I think you had a very favorable...
I think finances were very important to me, so I worked with Kareem before getting a date on the calendar just to make sure everything was like squared away, and also it worked out in my favor as well. So, yeah.
Wonderful. That's important. I mean, that's a reality. Any closing thoughts either of you have?
I don't think so. I think I expressed
Yeah.
my experience.
I want to tell you how grateful I am for you to participate in this, and grateful on a personal level, grateful for you putting your trust in me, and grateful for your helping others by giving them hope and sharing your experience.
Thank you.
Yeah, thank you, Dr. Bell.
My pleasure. Always.
Slay.
Yay! That was great. That
That
was
was
like a
good.
full
I'm like
podcast
totally leaking
episode.
though. Hopefully
How long
it's
did
not
that
gross.
last?
It was like 40 minutes.
Wow.
That's great.